But, you know, Alex mentioned in his presentation yesterday, and I'm sure we all took that little bit of a quote from him, that we have to talk, the talk is about tickle down meanness. I looked at my colleague Jane and I said, what is meanness? Is that a new English word? And it is, you know, it's about hitting them when they're down. And I'm, you know, borderline paranoid, you know, any good labor leader is. If you're not, you have to watch your back. But I do believe there's a conspiracy, there's a plan out there to attack our healthcare system, to starve it to death. Then people are going to start thinking, well, of course we have to privatize it. Look, we have no other choice. We have to privatize it. So what nurses unions have been doing, and I'll go through the history, but for over 10 years, is looking at the cost of drugs and how can we improve and save money and really enhance our healthcare system. Last August, some of us were all at the Council of Federation, and Gil was there too, and I made a short presentation to the Fed presidents about our newest paper on pharmacare, and Gil looked at me and said, Linda, imagine us unions proposing a social program that would save money. Well, that's exactly what I'm going to be talking to you today, is a social program that would save money. I thank you for your invitation to come and speak with you, but also to spend 2 days with my colleagues at UNA, fan club over there, blah, blah, blah. And we are all, hopefully by the end of my talk, we will all get together and be on the same bandwagon to lobby for a social program that will save us money and provide direct access to safe prescription drugs, not all the Me Too's that we see out there. So now let's start the presentation. Look at this. The red line, of course, is Canada. And why would we do it? I'm not a health economist. Most of people that know me, I can't count to 10 straight. But when you look at billions of dollars that are wasted, when you look at the other countries of the world are doing better than us just on one little portion of our healthcare system, which is prescription drugs, we have to look at it seriously. And it's growing. Look at this. Since 2000, look how the price of drugs have went up. That's just for our country. Now look, maybe I will compare it to Germany. That's Germany. Okay, that's Germany. Look about Australia, beautiful country. Public health system, National Pharmacare Program. Look at their cost of drugs. Look at France. Of course, it's a beautiful country. Even your director of communication was born over there. Did you know that? He speaks French over there. Look, double the cost of Canada. The UK, for all you English people, look at that. They do better than us. Big surprise. And look at this. Almost every other country who has a public health system in the world furnish prescription drug program under a national plan, and their cost is all lower than Canada. This is Canada, guys. We have to get it straight. We spend in our country over $34 billion in prescription drugs. Do not open your purses, ladies or guys. Don't look at your pharmacy at home. But we do take a lot of drugs in this country. And, you know, not the 1960s, 70s ones. You know, they all come. I don't know why I'm pointing over there, Rich. That's why he looks so good, I guess, eh? You know, it's that naturopath thing. You see? Where's Elizabeth? I'm not keeping to my notes, eh? But we do spend $34 billion on prescription drugs. That's 13.5% of the total cost of healthcare. That's a lot of money. And when we look at that $34 billion, 41% is publicly funded because we fund for seniors, we fund for people on Social Security, we fund for other things. So provinces are very interested into a National Pharmacare Program, and we have to look at it ourselves too. If I look for unions, because, you know, workers, nurses pay my salaries. If you're all elected, then the full-time workers out there pay your salaries. For workers, it's 10% of payroll is put towards a health and dental plan, but mostly if I just look at the health plan to pay for your prescription drug. 10%. How many of you have been at bargaining tables? Just raise your hand. What could you do with 10% of payroll? I don't know. Extra vacation, extra salaries, would help in all the wage freezes that everyone's talking about. That would help in Prentice for sure. But 10% of payroll. And if I look at the last bullet, because it is a question of money, but a question of care too. 1 in 10 Canadians cannot afford the prescription drug, so we have to do something there. Now, the impact on Canadians. 12% of adults visit ER because adverse effect or reaction on their drugs. Never mind that, 6% of all hospitalizations are because patients do not take their drugs. The real word is non-adherence, and I'm so glad they give all the hard words to pronounce to Brad and not to me. It's hard enough for me. But 6% of hospitalizations are because patients are not taking their drugs, period, or they're not taking them appropriately. That to the system alone is a cost of $7 to $9 billion. That's a lot of zeros, my friends, where again we could fix this. If I look at giving you a little bit of history, the first report on a National Pharmacare Program was done in 2004. 2004 was one of the first Council of Federation in Niagara-on-the-Lake. The premiers came out of their meetings, and Premier Danny Williams at the time from Newfoundland and Labrador came out and really brought the others out to talk to our health economist, which back then was Armin Yelnissen, to what do you mean we would save money if we'd have a national prescription drugs? That was just before the health accord was signed in September. Premiers were on board. They negotiated in the health accord a national pharmaceutical strategy. Then Harper got elected. Well, anyway, Harper got elected. We'll work on that by the end of my speech. 2010, Dr. Marc-André Gagnon from Carleton University, and then he was at McGill, wrote the first report on analyzing the costs. We had made presentation to the federal government when they were looking at pharmacare strategy and saying, look guys, you know the numbers. It's your job to calculate how much it would cost us, how much it would save us. In 8-9 years, they never did anything. So with the Canadian Health Coalition and CFNU, we helped sponsor the 2010 project. Nothing happened again. 2014, CFNU sponsored, and that's the copy you have in front of you. Again, we told Marc-André, we need you to refresh those numbers for today, for 2013-14, but also we want you to divide it and say, how much would Alberta save? How much would New Brunswick save? So when we meet the premiers, we'll be able to say, here are the millions, the billions you could save. And that's exactly what he did, and he presented to the premiers last summer. And I guarantee you there were a lot of attention there and a lot of interest. So in 2015, and that's the slide in front of you, that was just last month, we're still in April, yeah. Just last month, the doctors, that's the Canadian Medical Association Journal, so that's a scientific journal for doctors in this country, are saying the same thing. It was quite interesting for them to say the same thing that progressive leaders like us over the last 10 years have been saying, but it's there. But I'll brag about our stuff and leave the doctors to brag about their stuff. So this is our report. We talked about $11 billion. I really like the AFL issue primary, and I'll go back to my office this weekend and early next week and talk, okay, can we do this for a convention? And maybe Gail's speaking at our convention, by the way. Imagine poor Gail with 1,000 nurses in Halifax. I know, somebody has to do it, it's just name of the game. But he's going to speak on the temporary foreign worker, because like it or not, we're kind of experts in healthcare, but temporary foreign worker, other than being at meetings like this, we need expertise like the AFL to come and talk to nurses across Canada and say, okay, this is a big issue. We need to talk about it, and we need to be educated on it. So I'm very pleased he'll be doing it there. But we might need an issue primer like you've done here. So they have cheat notes, as I say, so you don't have to take many notes and go from there. But let's look at the countries. No, I didn't switch yet. Okay, here it is. Let's look at the countries again. So if I look at the well, something's happening there, but doesn't really matter. If I look at all the richest countries in the world, and how do we do under a public system, of course, and how do we cover? For Canada, it's about 50% of the population. Again, I can't see it up there, even on my tippy toes, but you see it. It is 50% coverage for Canadian. We're one of the richest countries in the world. Look who's just below, above us, Mexico. Turkey, and not the Turkey at Thanksgiving. Turkey, one of the poorest country in the world, coverage, and Mexico cover their citizens for prescription drugs better than us. So if I talk about solutions, solutions are simple. 100% access, similar to our healthcare system, equitable access, and reduce the cost by a national formulary and bulk buying, and increase safety. And to do this, we need to get rid of Harper. We'll get there. If I look at that, the first statistics here, I was stunned when I heard that. A third of seniors take medication that are proven to put seniors at risk. Can you imagine? So the evidence is showing that if a senior, somebody over 65, takes this drug, they're putting themselves at risk. A third of them are still taking it because we do not have any oversights on how prescriptions are done. That is scary. Now, you're from Alberta, you're rich. You know, everyone I've told you the last 2 days I've been here how rich you are. The oil is pouring, or it's not really pouring, but it's there. And Ontario is still the biggest. And now that I live in Ottawa, I hear it all the time. Ontario is the biggest, you know, navel of the country and all of that. But you're one of the richest, if not the richest. Ontario still has the best price for prescription drugs in this country. You cannot negotiate a better deal for any prescription drugs than Ontario, and that's why they're leading a lot. Well, even for Ontario, they pay 5 to 25% more for the 5 top generic in this country. They can't even negotiate a better price than what we would have if we'd have a National Pharmacare Program. And now here's your buddy. I asked the office, I said, can we Google a few cartoons of Prentice? That came out. I thought it was kind of cute. It was just before your budget and what he was going to do. But, you know, the cartoons, they gave us a lot of choice. Now go back to numbers. Look at all those numbers. Imagine if they would have put all the zeros. This scenario that Marc-André Gagnon gave for us for Alberta just talked about if we would only do bulk buying in the country, and for Alberta, you would be saving $248 million. That would be a saving automatically of 9% of your total cost of prescription drugs, just by doing one thing. Now, and the majority of the reason for this is we have to remember that when you buy drugs privately, the administrative costs are about 15%. If it is through a public plan, so for example, for our seniors, it is 2 to 3%, and that's where the savings would come through. Now, if we would do scenario 2, which is reforming the way, one, we buy drugs, the way we prescribe, and the way we give access to them through a national formulary, for Alberta, you would save 40%, and that's close to $1 billion, a little bit more than $1 billion. 40%. Imagine what your Minister of Health could do with $1 billion. You heard a lot about education at this conference. You heard a lot about healthcare, and what could you do with $1 billion? Now, I talked to you about Ontario. Ontario has the best price in prescription drugs. Eric Hoskin is the Minister of Health in Ontario, and he is the biggest cheerleader for a National Pharmacare Program, knowing that he still gets the best price. He is on every social media, talks about it all the time, and he will be our champion at the Council of Federation next July in Newfoundland, Labrador, because he knows it makes sense. Not only for his province, it makes sense. We're getting support in PEI. Okay, no big surprise. We're getting support in Newfoundland, Labrador, in Nova Scotia, in New Brunswick. Well, they've changed government. We have to go back, knock at doors there. Manitoba, even Saskatchewan, who's kind of dark blue conservative, are saying, okay, we can save billions too. We want to talk about it. The Yukon. I can't name Alberta here because Heather Smith is quite a person in Alberta, but to get a meeting with either Minister of Health or Premier to discuss this is almost impossible. Sorry, we'll look at that. She left before my, oh no, there she is. I thought she had left before my presentation was over. She was going to be in deep. But Alberta's not there yet, and we just need to work very hard. If I look at what we could do, that's for across the country. Remember, I represent nurses. If we'd have a National Pharmacare Program, we'd reinvest in healthcare. We could look at $4 billion into home care. That would mean almost 250,000 more seniors receiving home care. We could look at community health centers. We could have 10,000 more long-term care beds, and of course, we could hire 28,000 more nurses. But, you know, we could expand that. And some will say, well, Linda, to have that, you mentioned what the savings would be, and the best scenario would be a saving of $11.4 billion. The worst case scenario, even if everything wouldn't work as Marc-André talked about, we'd still save $4.2 billion. The last report that the doctors came out with, they talk about the cost of the federal government. The best case scenario, it would only cost the federal government $1 billion to implement a National Pharmacare Program. The worst would be $5 billion. Now, you heard Alex yesterday talk about the federal debt. You heard about the province's debt. The federal debt, they're going to come with a balanced budget supposedly next week. Every province is into a big, deep red deficit. Shouldn't we balance this out? Shouldn't they be spending money to help the provinces? Because the provinces are in charge of this. Now, I'm in Alberta, I have to look back at Alberta. If you would get an extra $1 billion a year, of course, some of you might say, no, Linda, we have to spend it in education. Didn't you hear? We're having all these younger population, etc. But if I just look at healthcare, you could have about $400 million in home care. That would be 27,000 more seniors. We could open up 80 community health centers. We're all talking about getting healthier, about being more access in the community. We could do that. We could have 761 more long-term care beds, or we could hire 2,500 more nurses. That's what we could do. Now, what will we do about it? For CFNU, it's simple. We are, for the first time in our history, because I'm sure you know nurses are nonpartisan. You know, it's always a sticky issue when we get at union meetings, and for me at the CLC, it's the same thing. We're nonpartisan, but we still have common sense. I tell my members, I said, guys, I'm not going to tell you how to vote, but look at the pros and the cons. If you don't make a decision, you've heard it through this conference, we will not recognize our country. We will lose our healthcare system. I was speaking at the Broadband Institute a few weeks ago in Ottawa with Roy Romano, and I said to the delegates there, guys, get mad. If we do not get mad for the next federal election, we will lose our healthcare system. He has already talked about it. He wants out of healthcare, and I'm talking about Harper, wants out of healthcare, and we have to make it move. Now, we have to make sure that we talk about not only the problems of healthcare, we have to talk about solution. Pharmacare is one. On Thursday morning, that was yesterday, Elder, I think his first name was Will, reminded us about the buffalo hunt. And I really like that in his song, but you know, the buffalo hunt for us who live and work in Ottawa and do national work, it's October 19. The buffalo hunt is about getting rid of Harper. Your buffalo hunt, yeah. Your buffalo hunt is about getting rid of Prentice. And then do not lose energy, because we have to work together by October. You will soon see, and I'm hoping by June it will be ready, we hired another health economist because it's very important that the numbers don't all come from unions. So we hire outsiders that are very friendly. And you, Mackenzie, is going to do the cost because, as you know, without a health accord, the provinces, except Alberta, it's only because you're young and beautiful, you're going to get more money without a health accord. That won't last very long, but that's what kind of our Prime Minister, who kind of loves Alberta, loves even more Calgary, you know, he's going to give you an extra $1 billion while everyone else is going to lose $36 billion, but don't bring that to the bank because it won't be there. Anyway, you, Mackenzie, is going to do for us the same thing we did for Pharmacare. So if I go back, I'll see, look, same thing we did here. When we showed nurses, when we're showing you, if we'd have a National Pharmacare Program, this is what we could buy. You, Mackenzie, is going to take that $36 billion and say, for a province, this is what you're losing. This is how many jobs you're going to lose in healthcare. This is how many hospital beds we're going to have to close. This is how many long-term care facilities we're going to have to close or privatize or whatever. This is what's going to happen with that money, because we need, as leaders, to connect what's happening in Ottawa to the pain and suffering that's happening in your community. And if we don't do that, they will win the next federal election and we will lose our healthcare system. So now, again, why are we doing this? Look at that. I showed you that earlier. It's because of the cost. That is in what, 12 years? And look how much we have doubled, if not more, the cost of prescription drugs. And we have to do it, and we have to sing all by the same song sheet. Now, Gil, you know I love you, eh? You know. And yes, you bragged yesterday how the AFL is standing up to bullies, and every time proposed actions or attacks, on workers, it happened in Alberta, and you've been at the CLC for almost as long as me, but he's a young kid, you know, and everyone at the CLC, we sit there and we say, well, at least it's in Alberta, you know? It's in Alberta. And, you know, we say, yeah, another attack on workers, it's in Alberta. We can't say that anymore because it's coming out everywhere. We have to be talking about the next federal election. We have to be talking about a safe seniors agenda. Don't let a politician come and knock on your door with I love Medicare button. They'll probably look at Sandra, wherever she is from your Friends of Medicare here, and say, oh, can I wear your button? And then don't want any federal leadership in healthcare. Or you'll have organizations say, we need a seniors agenda. Oh yes, we all want to be 92 years old driving our cars and playing racquetball. Well, I hate to tell you, maybe Reg will be doing it. I don't play racquetball now, and I don't plan to play it at 92 years old. But some of us will be sick, and some of us will need help. And that's what, as a society, we have to talk about a safe seniors agenda. Today, we have 15% of our population that's over 65. But by 2036, they predict it'll be 25%. So some economists are saying, oh my God, the white tsunami is coming. It's not. It's about 1% of the total cost of healthcare in regards to increase. Why? Because seniors, now I'll talk about age. Are you 65, Rich? I think so. You think so? Gorgeous 65-year-old here. But they are healthier. And that is the important thing to remember. Yes, we're all growing older, but yes, we're staying healthier. I was stunned to know that in Canada, 98% of seniors still stay in their home. 98%. Yes, we have 250,000 that are in long-term care facility. But that 98% couldn't stay in their home if they wouldn't have help. There's an H there, forget those. But you know, 92% of seniors who stay in their home need help, either from a neighbor, from home care, or other services. So we have to look at that situation. We have to look that 14% of hospital beds are filled by alternate levels of care. That just means they need somewhere else to go. Hospital beds are an average of $800–900 a day. Compared to long-term care, it's $120 a day. do the math. Like, we have to do something on that situation. We also have to talk about mental health. 1 in 5 Canadians need mental health services. That's a cost of $50 billion that's there. And for our workplaces, the cost of mental health issues is $28 billion a year in this country. That's people who go off on long-term disability or short-term sick leave because there's no services in the community and they're stuck and they have to stay home. Aboriginal health. That is, you've heard about the missing and murdered Indigenous women. Aboriginal health is our shame. It is unbelievable for 1.4 million Canadians who are from First Nation descendants, which is about 4% of our population. Life expectancy, no, that's not how you pronounce it, you know it, live longer or not, is 5 to 7 years less than us. Just because you were born with Aboriginal descent. And if you're an Inuit, it's 10 years less. I was stunned. For Inuits, you can compare yourself to developing countries for life expectancy. This is crazy. And why? Because 20% of them, they have 20% more chronic disease. Why do they have 20% more chronic disease? Duh. Poverty, malnourishment, violence, unemployment, 3 times higher unemployment. It is a shame and we need to do something. And yes, Siobhan said, Linda, there's a little clock there. Hopefully you won't ignore it like other speakers, but it's in front of it. But I am closing up. Yes, we need to do it right. And some will say, well, Linda, you're asking for another program, regardless if it's 1 billion or 5 billion, another program. If we do it right, if we propose national leadership, we can have a fully accessible social program that will save money. And it's not a question of choice, my friends. You've heard over the last 2 days, we need a national child care program, and we can afford it. And there's no rhyme or reason that Alberta never could have afforded it before all of this national talk. You're richer than Quebec for... It's true, I'm supposed to swear. Everyone else has sworn, eh? But you know, my members are there. I'm up for election. I won't swear. But it is not a question of choice. We can get a national child care program. We can double up CPP so nobody retires in poverty. We can have full employment, and there's no reason to get unemployment, especially with our youth. We can have better environment policies, and we can have a National Pharmacare Program. The only thing we have to do is get involved in the next federal election. After you're done May 5th, 6th there, you party a little bit, you take a break. Gil will come to Halifax, get re-energized, and then we focus on getting rid of Harper and getting back our control of our country. I thank you very much. Merci beaucoup.